Okay, so we have another question, and that is, how can I tell whether my pet is in pain? What are the signs, and how can I manage the pain? So first of all, what is pain? Pain is a subjective and a unique experience that has huge variation among individuals, and this can make it quite challenging to be able to assess and to treat. In human medicine, obviously, we have the luxury in some but not all cases to be able to ask people to describe their pain to us. So we may ask questions such as, where is your pain? What does the pain feel like to you? When did the pain start? Have you found things that aggravate your pain? What can help make it feel better? Is there any difference in its behaviour? Is it different at night time to during the day? And sort of how's that intensity of that pain, and how's it impacting on your life? Now, clearly in the veterinary world, we can't ask those questions to your pet, so we have to rely on other strategies in which to help us identify, are they in pain? Now, this isn't an easy task by any means, because animals are absolute masters at hiding pain, and this stems from them being in the wild and it being quite risky for them to show if they are indeed in pain or if they have an injury or a disease, because it makes them vulnerable to being easy pickings by predators, or indeed for it to have an impact on their status within their social group. And this is still true of our domesticated pets. They will still try to hide their pain from us as best they can. So when you take your pet to the vet for an assessment, we'll use a lot of different modalities in order to try and identify whether they are in pain. So obviously, first, that will include talking to you, trying to get a little bit of history about what's been going on. We'll carry out an observational examination of your pet, just have a look at things such as, how they're presenting, what's their demeanour like, are they alert, looking at their body condition, those sorts of things. We'll be carrying out a physical hands-on exam, and using other things such as objective markers, so maybe pain score scaling scales, to be able to monitor your pet's pain over a period of time, so that we can then use that information to influence the management strategy that we take. So what can you do to help this process? Well, you're in a really good position in the fact that you know your pet best, and you'll be able to pick up on the clues and subtle changes in behaviour that may be sort of a key indicator as to things perhaps aren't all well with your pet's health. So this might just include things such as they are showing a loss of appetite, or there's a disinterest in playing with toys, or going out for a walk or playing in the garden. You may find that they're constantly licking or scratching at an area on their body. It might be that there's an area that looks quite sort of red and angry, or have other sort of discoloration within the skin. There may be some oozing, it might smell, it might be hot to touch. Other things that you might look out for are, is there a change to their breathing? Are they panting a lot? Are you noticing that there's an increase, rise and fall of their chest with their breathing? Are they drooling perhaps? You might notice there's a change within their pupil size, or there might be a change of their ear position. Or their general posture just might be different. It could be that they're quite hunched over, or they're quite flat and just looking lethargic, or might be looking stiff when they're getting up and trying to move, or very slow within their movements, or just doing some odd things. You might observe them walking around in a circle or something, falling over, the obvious things such as that. It might be that they're just taking themselves off and hiding, or perhaps they're becoming snappy or showing aggressive behaviour, which is unusual for them. It might even be that they're just flinching a little when you try to groom them or just stroke them. And it's just these little subtle signs that you will know as their owner, you'll pick up on first. And if you do notice any of these, then the way to manage it is to contact your vet. And indeed, if you're already allocated to a physio, you're working with a physio and you're worried as to whether you should be bothering the vet, which is quite often what people do worry about, then speak about your concerns with your physio and they can also advise you. But ultimately, in terms of management, there is no cure-all for pain. So it isn't as simple for us to say that you're going to give them some medication, or you're going to stop them doing a certain activity, or that you're going to do a certain exercise with them to strengthen or stretch a certain limb, or perhaps there isn't just a massage technique or a piece of electrotherapy that's going to help. It really is, as the pain perception is unique, so is the management strategy. So your management is to contact your vet and get your pet assessed. Okay, thanks.